And welcome back to The Verdict. Mick Cornett and Kent Myers. We're here each week talking about interesting ideas and visiting with interesting people. And this week we're going to talk about hospitals.
Hospitals, some place that we seldom want to frequent, but oftentimes have to, and we're so glad that they're there when we do need to. We're going to be talking with Craig Jones, the president of the Oklahoma Hospital Association, about hospitals today and tomorrow. The changes in the care that takes place at hospitals from 10 years ago has just been dramatic, and I think in the next 10 years it's going to be even more so. And we're going to be hearing a little bit about that.
Healthcare is the #1 issue facing America, and if you're in the hospital business, you get a lot of people giving you opinions on how they should be doing it better. So we'll hear from the industry today. It ought to be interesting. You're watching The Verdict. We'll be right back.
Every day America uses clean-burning natural gas instead of coal or oil is a day of victory for our environment. That's why Chesapeake chose to explore for natural gas exclusively, and we've never looked back. Because natural gas burns twice as clean as oil or coal, and reducing carbon emissions to combat potential global warming is every bit as urgent as cutting our dependence on energy imports. As America's #1 driller of new gas wells, Chesapeake is moving fast to find untapped reserves of natural gas here at home. It's the right fuel for America's economy and the fuel for a clean air future. We just happen to be early to see it so clearly. Chesapeake, natural gas wins the day.
Welcome back to The Verdict. Mick Cornett and Kent Myers, and Kent's going to introduce today's guest.
We're very pleased today to welcome back a guest that has been with us one time before, Mr. Craig Jones, who's the president of the Oklahoma Hospital Association and has been since 1998. Craig did his undergraduate work at Grove City, Pennsylvania College, did his master's work at the University of Washington Washington University in St. Louis. Has been a lecturer at the University of Oklahoma and other institutions on healthcare matters. He's a fellow in the American College of Healthcare Executives. It's his second visit to The Verdict. Welcome back.
Thanks, Ken.
Glad to have you.
We're going to talk about the Oklahoma Hospital Association. What does the organization do? Who's a member?
The members are basically any hospital that's licensed in the state of Oklahoma, although we do have some categories for other kinds of healthcare providers, institutions, if you will, except for long-term care. That's a separate organization. Mm-hmm. And our mission basically, Mick, is to promote the health and welfare of Oklahomans, primarily by advancing what we hope is quality health care, by providing services to our members to help them in meeting the health care needs of their community. We also try to educate the public on healthcare policy matters.
Is this a lobbying effort at the state legislature, or are there more to it than that?
Well, that's a major part of what we do, is advocating and representing the interests of hospitals in their efforts to meet the needs of their community. So yes, there is a component of that both at the state level and at the federal level.
Do you play offense and defense? Do you come up with ideas each year for the state legislature to consider, and at the same time are you on the lookout for legislation that you think might be harmful?
Absolutely, absolutely. I think historically we did more defense than offense, but I think over the last 10 years we really have tried to be more proactive in trying to introduce issues and put issues before the legislature that really will help impact the welfare of Oklahomans.
It seems to me that, Craig, just viewing it as a citizen, that there's a pretty terrific growth of hospitals going on now, new hospitals being built. You read about it all the time in Oklahoma City area where maybe the smaller type specialty hospitals are popping up, but also large acute care hospitals are still on the drawing boards. Is your membership expanding?
We have seen some growth in membership, Kent, but the building that the average citizens of Oklahoma will see, I think, is really attributable to two factors. One is that after World War II, there was a federal legislation called the Hill-Burton Act, which provided matching funds to communities to build hospitals. And so the vast majority of hospitals in the state were either built or had major additions back in the late 40s and early 50s, and those physical plants are just wearing out. And so hospitals over the last 10 to 15 years have been replacing that. I think the second factor is just the proliferation of technology, and where we've seen the trend from inpatient care to outpatient care. And hospitals originally were not built to handle outpatient ambulatory kinds of business. And so what we're seeing is a reorientation of the physical plant to be more convenient, more accessible, and quite frankly, less cost associated with the care. And that's, I think, what we're experiencing right now.
What other trends are you seeing in your line of work right now?
Well, when we talk about trends, Mick, we tend to talk about access, quality, cost. That's what everyone seems to be interested in. And those still are the three primary areas, but probably the advent of consumerism and the average patient and member of the public being much more aware and having more information at their fingertips due to the internet, we're seeing greater expectations. There's a more, I think with the generation of the average citizen that's out there, they're used to having information, they're used to having things quick and accessible to them. At the same time, I think that the advent and increase of chronic disease as a percentage of the kinds of care that hospitals and other providers are having to deal with is dramatic in terms of its impact.
Such as?
Well, obviously heart disease, cancer. Probably the one area that has become a chronic illness that has a tremendous, unfortunate impact in Oklahoma is obesity. We've seen a terrific rise in the percentage of obese patients, particularly among young people.
Over what time period?
Oh, I'd say the last 10 years. The last 10 years.
What do you attribute that to?
Poor health, poor nutrition, lack of exercise. Unfortunately, there are a lot of fast food facilities in Oklahoma on a per capita basis. But I think overall, it's really a tragedy that when you look at statistics and certain studies that have been done that the Oklahoma State Department of Health has been directing, that the overall status of health in Oklahoma is just pretty poor. We rank in the very low end of all the states, and there's a lot of effort being done to direct some activity towards that.
Let me ask a question about smoking. There were, of course, class actions against tobacco companies in the state of Oklahoma, reaped a very large settlement. In the past 5 years or so, have you seen any decline at all in smoking type health-related issues?
I think there has been some decline, Kent.
Emphysema and the like?
There, with the advent of increasing the tobacco tax, which was a lot of the funds for that were used for to cut down on the number of smokers and to direct care towards trauma and other kinds of activities. I think there's a general trend of less smokers, but unfortunately, Oklahoma has bucked that trend, I think, nationally. We see still more smoking among young people, and that's why I think the advent of the increased tax makes it economically more difficult for young people to afford to smoke. But the trend is down somewhat, but we still have a long way to go.
I'm sure the presidential elections are catching your eye and hospital administrators all over the country. What's your take on how the campaign has evolved and specifically with how the two main candidates are discussing health care?
Well, that's the $64 question, in that I think that the advent of healthcare policy is probably going to play itself out a little bit more strongly in this election than what we've seen in recent elections. We'd have to go back to the first term of President Clinton. I think the real shame is that we really have no national health policy. What has been driven is the cost of care and how much the federal government wants to spend on health care. You have the traditional positions, I think, of the Democrats and the Republicans, whether or not you want to be more privately involved with insurance and let the private sector assume that responsibility versus a greater role for the federal government. I think there needs to be a combination, quite frankly. The American Hospital Association, which we support and are integrally involved with from a grassroots level, has been spearheading a dialogue really among many stakeholders to try to address what are the principles upon which health reform ought to be based. And that dialogue continues, but it's unfortunate that it gets politicized. And there's a lot of things that we could be doing individually to improve health care, but we as individuals just won't assume that accountability and responsibility.
I looked to your website getting ready for this show and noticed that one of the things that you talk about on your website is transparency of price, or transparency in price, that hospitals are changing to. Can you talk about that a little bit?
Yes, that really goes back to the consumerism issue, I think, Kent. I think hospitals are realizing that the general public wants to be in a position to compare one facility to another.
To shop.
Exactly.
Yeah.
You can go online and you can shop for a used or a new car. You can shop for different kinds of products. And there's nothing more important to us than our health care. And the average consumer wants to do the same thing. So we have been working and taken initial steps to, first of all, to put online a website that will allow hospitals, or to allow the public to compare hospital charges on a diagnosis basis. Now, charges aren't nearly as informative as the cost, your out-of-pocket cost, but this gets rather complex, and depending upon the insurance you have and what kinds of coverage you have, it's an initial step and begins to give a little bit of a picture. The second point we're going to do is to do so with quality indicators, and that will be coming forth later this year.
We have just barely touched the surface on the healthcare and the hospital business. We got a lot to jam in this next segment, so stay with us. You're watching The Verdict.
Home values are down in some states, but not in Oklahoma. Oklahoma's home values have increased 4.2% during the past 12 months. Unlike some states where home values have decreased as much as 20%. Good thing you're in Oklahoma. There may be real estate problems in some states, but there has never been a better time than now to buy or sell a home in Oklahoma. One of the most affordable states in the country, Oklahomans are buying and selling homes every day, and an Oklahoma realtor can show you how. Good thing you're in Oklahoma.
Okiwani is an Indian name for a place where children play. When we obtained the camp, we found a lot of oil debris left in the woods. We saw a commercial about how the oil and natural gas industry cleans up old oil well sites. We called the OERB and they agreed to remove tons of concrete and steel. It didn't cost us a thing. Thousands of children have left their footprints on this land. Thanks to the oil and gas industry, they will for a long time to come.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
Welcome back to The Verdict. We're visiting with Craig Jones. He's the president of the Oklahoma Hospital Association. And I think, Kent, when we left off, you were wanting to talk more about electronic information.
Yes, I understand. Of course, information is transmitted all the time electronically now, and I suppose hospitals are no exception to that.
Absolutely. There's a tremendous trend in trying to see hospitals develop more capabilities in being able to transfer health information electronically.
For patient A, is there a concern about the privacy of the records? And to whom they're distributed? And
Well, there certainly is, but there are pretty stringent federal regulations and technological safeguards that are put into place to try to safeguard that type of information. But the efficacy of being able to obtain information from one provider to another provider as patients move from physician to physician, from hospital to hospital, from state to state, just will allow that care to be offered in a more cost-effective way. You won't have to repeat certain tests if you have access to the results of tests that were done just days or weeks before. It truly is going to revolutionize, I think, medicine.
What about the idea that third-party payments are a problem in healthcare? Do you abide by that theory? The fact is that the consumer doesn't necessarily the one that writes the check, that the insurance company's writing a check, and that's a breakdown in the way the system should operate?
Well, it has its advantages and disadvantages, Mick. The fact that the patient doesn't feel the out-of-pocket costs because someone else is paying for it certainly has an impact on people seeking care.
Sure.
You and I that have health insurance, there's less of an impetus not to seek or utilize the care if we don't have to incur a cost. But that trend is changing with higher co-insurance, higher deductibles. But I think that the advent of allowing the consumer to play a larger role in the decision making and what the financial consequences of those decisions are, I think has to be a part of the future.
I from time to time see ads that individual hospitals run. I won't name them because I can't remember them, but about we were rated #1 in heart surgery or something in the region. I suppose there are rating services that do evaluate hospitals and then rank them. Does that go through your organization, or is that outside your organization?
It's outside our organization, Kent, because of the overall cost of care and the differentiation from one institution to another on the basis of cost has become less and less and less. Hospitals, by virtue of the scope of services that they provide, the quality of services that they believe that they have, is an attempt to try to differentiate themselves one from another. But there's a lot of independent activity, as well as the federal government, that's putting forth quality measures that will assist the public in understanding that.
How has term limits affected the legislation that you've seen go through the state capitol as it affects hospitals?
Well, I think the obvious change has been the fact that you have new faces there that have less of an understanding of the issues that have been dealt with in the past and the current issues. So there is a great challenge by our organization and others to assist the new legislators in gaining and coming up to speed on health issues that are important to the public.
Do you provide them educational forums or anything like that?
We try to meet with them one-on-one, but it's interesting that you asked that question because we literally are in the process of developing what we are referring to in-house as a Healthcare 101 handbook, basically to try to provide a succinct, clear, broad base of basic information that will help new legislators understand the nuances of healthcare policy.
Immigration has been a hot topic at the state legislature. Have you all been involved in those discussions, and how do you come down on what's been done and what's been the ideas that have been coming forth about it?
More so on the periphery, Mick. Hospitals obviously are not enforcers of immigration or the laws associated with that. And in fact, there are very clear federal laws that prohibit hospitals from not providing care based on someone's age, sex, ethnicity, or whatever. And so we have to follow that pretty carefully. At the same time, we're concerned about in some of the clinics, some of the free clinics that are around that tend to treat a lot of the immigrants that have come to Oklahoma, that because of some of the recent laws, it's unfortunate that they're concerned about identity, makes it more difficult to share and to be able to track those patients as they go from clinics to hospitals. So it's an issue that we're monitoring, but it's going to be a difficult one to wrap our arms around.
Kind of an offshoot of that same question that Mick asked, what about the training for your ER personnel or your admitting personnel and them being bilingual?
Clearly, there's been a trend in developing just that among those frontline kinds of individuals. Hospitals, again, due to federal law, are required to post certain kinds of announcements in more than just English. We have the whole issue about English as the primary language. But all hospitals will have some resources that they can rely upon for patients, whether they're inpatients or outpatients, when it's required to direct the proper care. They'll get linguists involved in helping to interpret the needs of the patient.
There's a lot of urbanization going on around the world. People are moving to cities, so the rural areas are becoming less dense. With the lack of density becomes fewer hospitals and a lack of quality medical care. How concerned is your organization about that, and what are you all doing about it?
Well, Oklahoma is a rather rural state, and we have approximately 129 members of our association. Half of those will be in communities where the hospital is under 100 beds, and half of that half will be in communities where the beds are under 50. So rural health care is a real issue, and access to care, whether it be physicians, there's a real need to recruit primary care physicians and certain key specialists, general surgeons, orthopods, out into the rural areas. We have a real problem right now in Oklahoma with ambulance coverage. We've seen a lot of the ambulance companies fold because, again, of reimbursement. The governor had a task force recently to look at that and made some recommendations that we're working with him on.
Does the state have to subsidize rural ambulance service now?
Not so much the state, but local communities will pass you'll see county or city taxes in support of an ambulance service. There are a number of those that are run by the hospital themselves. There is some increased funding we just found out that has come from the Cherokee tribe negotiations on the tobacco tax. There's going to be some increased funding that is going to be directed towards ambulance care.
I've heard it's said that the emergency room physician has morphed into the primary care physician for many people. Indigent, uninsured, underinsured, that go to the emergency room for where they would normally go to their primary care physician. How has that changed the recruiting of emergency room physicians?
Well, you're exactly right. That's probably one of the key trends that we've seen in hospitals is the increased emergency room traffic, if you will. The level of care that's being rendered and the fact that you have to try to triage from non-emergent care to the true emergent care, it's put much more emphasis on the quality and the number of emergency personnel that are caring. We have about 700,000 Oklahomans that don't have any insurance, and so that becomes their primary mode of receiving and having their needs met.
What changes do you see in healthcare? We titled this show Hospitals Today and Tomorrow. What should our viewers look for as changes in the hospital of tomorrow that they don't see now?
Well, I think you're going to see, because of the shortage of key healthcare personnel, I think you're going to see healthcare being provided in more settings outside of a hospital, trying to make it more accessible to patients, using what we call physician extenders to provide care that doesn't require a medical degree to do so. I think you'll find hospitals being more open, as we talked about, transparent with their services to others. And I think that you'll find that the responsibility and the partnership that hospitals will seek in rendering care and trying to equip homes and home caregivers to be an extension of some of the services that they've seen. But you'll also continue to see a great proliferation of technology, of pharmaceuticals, of diagnostic care that's being provided less invasively. And all of that's very positive, but unfortunately there's a cost associated with it.
We sure appreciate you coming on The Verdict. It's been enlightening, and just the sheer variety of topics that we discussed only shows us we probably should have had an extra show on this topic, and
we'll have to have
you back in the future. Craig Jones at the Oklahoma Hospital Association, thank you and all of your members for what they do for Oklahomans. We'll be right back with more. You're watching The Verdict.
good life comes naturally to Tulsa, where nature's beauty is matched with an eye for aesthetics. A legacy of neighborhoods graced with lawns and landscaping and handsome homes. A place that seems to have patented an ideal lifestyle. Bank First is loyal to the quality of life Tulsa assures its citizens, to the priority placed on education, culture, and growth. Loyal to builders who transform raw land into residential charm. Developers who see opportunity and add vitality to Tulsa's economy. Bank First serves both enterprise and private lives that need a loyal partner. It's how we help nurture this city's very good life. Bank First. Loyal to Oklahoma. Loyal to you.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information.
Everything you wanted to know about hospitals but didn't know whom to ask, Craig Jones filled us in.
Always good to have Craig on. He's always got a lot of good information. It'd be interesting to see what the hospital of the future looks like and how we change over the years and what kind of institution we attend when we get seriously ill.
As Dr. Coburn has pointed out to me one time, most of us are born in a hospital. Many of us end our life in a hospital. And the bulk of medical care that we ever receive is in that first part of our life and at the end of our life. Yet it's the in-between time that we spend our time paying for it and trying to figure out how we should deal with health care. So it's an interesting topic, and if you'd like more information on Craig's organization, you can go to the website. It's okoha.com. It's for the Oklahoma Hospital Association. Well, that's going to do it for this show. For
whatever his name is.
Whatever Kent Myers' name is. For Kent Myers, I'm Mick Cordette, and we'll see you next week on another edition of The Verdict.
The preceding program was produced exclusively for the Cox Channel.